Hey guys, it's Scott here with Movementologist, and it's Manual Monday. Today we're going to talk about mobilizing the shoulder. We're going to do a posterior glide, and we'll do a couple different variations. So we use shoulder joint mobilization, obviously to improve shoulder mobility, also to decrease pain. So if we find in our exam that we have limited capsular mobility, limited range of motion, we can apply the mobilization to see if we get improvements within session, and that will help guide where we go with our manual therapy. So when I'm doing a posterior glide of the shoulder, the most common technique that I'll use is kind of a cradling technique with the arm here. And I like to have this so I can apply some distraction to the shoulder, just to help the patient to relax, also to create some more space in that shoulder joint. So I have her in neutral rotation here. I'm going to use my mobilizing hand right off the acromion and the glenoid on the humerus. And I'm going to apply that glide in an anterior to posterior direction, also with just a little bit of a lateral glide so I'm not butting up against that glenoid rim. So I'm applying my glide. I can do grades 1 or 2 or give a little greater force. Now the studies say if you're trying to improve mobility, you're likely going to want to go high grade, grade 3 to 4, and also at end range. So if I want to get to end range, let's say we're trying to improve internal rotation, I'm going to internally rotate Lindsay's arm. I'm still applying a light distraction force here. And now I apply that same glide. How long, how many times? Most studies look at 3 by 30 seconds, but maybe just for a minute or two, we're just working that posterior shoulder, maybe a couple different directions of force. So once I mobilize the shoulder, you can also add a nice mobilizing technique, which is more of a passive stretch. So JJ, if you want to come around this way, I can stabilize Lindsay's shoulder joint with my left arm. So I'm getting my forearm, my elbow across the shoulder complex there, and I can add some distraction here if I want, and then I'm applying a passive internal rotation stretch with my right hand, and I can have a long hold, 30 seconds to a minute, or I can do a little bit of oscillating here, just depending on patient comfort. And then once we've mobilized and stretched Lindsay's arm, we can work on posterior shoulder soft tissue. We can show her soft tissue mobilization. We can do posterior shoulder stretching. So we'll talk about that on Thursday for Thorax Thursday. Otherwise, have a good rest of your day. We'll see you next time.